So back pain alone is not the same as sciatica. Sciatica is a pinched nerve in the lowest part of your spine or the buttock that sends pain down the legs. Now here is how we're going to get rid of it. So to get rid of sciatica, we really need to understand why you're getting it. There's two major reasons why that could be. Number one is a pinching of the nerve in the lowest part of your spine, often from a disc prolapse which presses on the nerve and sends pain down the leg. The second reason is a tight piriformis muscle in this area, in the buttock, and that again can pinch on the sciatic nerve. And I'm going to give you an exercise to get rid of both of them. So before I explain what you should be doing to get rid of the sciatica, let's figure out what you need to stop doing to continue aggravating it over and over again. So if you bend forward like this, you're putting massive pressure into the discs in the lowest part of your spine. That needs to stop. Every time you bend forward with the banana back like that, you aggravate the disc, continue to put pressure into the nerve, and that's what we need to avoid. The way to bend forward is more like this, pushing your hips backwards, keeping a straight lower back. You'll find that you aggravate this back pain and sciatica way less by doing that. So for sciatica that's coming from the lowest part of your spine, you've got a disc prolapse pressing on the nerves, shooting pain down the leg. We need to give you an exercise to decompress your spine and take pressure off the nerve. We're going to use this. So find a table or a chair, hands on, hips off, and let your hips drop down. So basically you're decompressing your spine, taking pressure off the nerve. So this is what we're looking at. The disc prolapses out, presses on the nerve, sends pain down the leg. If we can do this and decompress, we're taking pressure off the nerve. That's exactly what we need. Another way to decompress your spine is by finding a kitchen counter or a surface like this, elbows on, and let your hips hang. So your hips are hanging down and I can feel a decompression traction through my spine. This is a great way of doing it. Give it a go. Now, if you've got the type of sciatica that gets aggravated when you're sat down for a long period of time, the pain starts in the buttock, goes down the leg, there is a good chance you've got piriformis syndrome, which is when the piriformis muscle deep in the buttock gets tight, pinches on the nerve, sends pain down the leg. We need to give you some exercises to take the pressure off that muscle and off the nerve for less sciatica. So simple as this, you're going to place the aggravated, painful side over like this, knee down, and lean your body forwards. I can feel a stretch in that area there. Another way you can do it is in this same position like this. So basically pulling that leg up like this. You'll stretch the piriformis muscle, take pressure off the nerve, hopefully reducing that sciatica. There's one more way we can release that piriformis muscle, and that's by getting a tennis ball, popping it on the floor and sitting on the ball on that painful piriformis. So you keep the pressure on the ball, on the painful spot. It's going to be very sore. It might even send pain down the leg. You hold it there until the pain drops off, and then you move to a new area. Move again, find the painful spot, do 4 or 5 times all through this area to release that muscle off. Now I really hope that these things we've given you today helps get rid of your sciatica and gets you feeling better and moving better. If you're not sure whether you've got sciatica from the lowest part of your spine or the piriformis muscle, then just do them all because they're all going to help to some degree. If you would like more sciatica help, watch my other sciatica videos. There's specific piriformis syndrome videos, specific disc prolapse videos. You'll find lots of help there.